All right, let's get into it. Today we're diving into a medical detective story that's been 30 years in the making. We're talking about a 65-year-old man, and get this, the villain here is his own body. A system that's supposed to keep him healthy has gone completely rogue, and it's pushed him right to the edge of a life-threatening crisis. So let's start by unwinding this 30-year journey that got him here. To really get what's going on, you have to understand the patient's long and frankly painful journey. This wasn't something that just happened overnight. For decades, his body has been sending out warning signals. And now, all those signals have come together to create a perfect storm. And this timeline, wow, it just lays it all out. It really all started 30 years ago with painful reoccurring kidney stones. You fast forward to 2022, and boom, he gets an official diagnosis of chronic kidney disease, which means he needs regular dialysis. But today, right now, is the absolute breaking point. A hip fracture, a bad infection that followed, and a body that has been pushed to its absolute limit. So, just like in any good detective story, the medical team had to start gathering the evidence. To figure out what's gone so terribly wrong, we've got to look at the clues hidden deep inside the patient's own body chemistry. Okay, so the first huge clue is this number you see here, a parathyroid hormone level of nearly 2,200. Now, just to give you some perspective, a normal level is somewhere between 10 and 65. This hormone is basically the master regulator for calcium in your body, and calcium is essential for everything from bone strength to how your nerves fire. So a number like 2,200, it isn't just high, it is off the charts, astronomically, alarmingly high. It's a massive, flashing red flag. So what in the world does a number like that actually mean? Well, it means the glands that are supposed to be managing this crucial calcium balance are just screaming at the top of their lungs, completely out of control. Let's pull up the full case file and see how all the puzzle pieces fit together. Okay, so check this out. What's so wild is how all these clues start to connect. That insane hormone level is jacking up his calcium, even while doctors are trying to bring it down. Then you've got high phosphate, which is a classic sign of kidney disease. And the result of all this? His bones have become severely fragile, porous. And finally, an ultrasound confirms it. This isn't just one rogue gland or a single tumor. All 4 of his parathyroid glands are enlarged and are working overtime. So, with all these clues laid out on the table, the picture starts to become, well, terrifyingly clear. The medical team has finally identified the culprit behind this entire 30-year ordeal. The diagnosis is tertiary hyperparathyroidism. Now, here's the best way to think about it. Imagine your parathyroid glands are like the thermostats for the calcium in your body. Because of his chronic kidney disease, they've had to work in overdrive for years just to keep things balanced. And eventually, after all that time, they just kind of break. They get stuck on full blast and they stop listening to any signals from the body telling them to calm down. They've gone rogue. And the physical toll this takes, it's just devastating. This quote from the actual surgical note says it all. To get all that extra calcium into the blood, the body is literally robbing the bones of calcium, day in and day out, leaving them dangerously weak and porous. And that leads directly to something like a hip fracture. Okay, so we've got the diagnosis. But now comes the really tricky part. The team is facing this incredibly high-stakes decision. How do you shut down these out-of-control glands without accidentally causing an even worse, more immediate crisis? You can see here they basically had 2 choices. On one hand, you have surgery, the only real permanent cure. It fixes the root of the problem and helps his bones in the long run. On the other hand, you have medication, which is really just a temporary fix, a bridge. So surgery sounds like a no-brainer, right? Well, there's a huge catch. It comes with a massive immediate risk, a really dangerous complication called hungry bone syndrome. And this is where things get really dangerous. For years, this man's bones have been literally starved of calcium. The second that surgery shuts off that constant flood of hormones, his bones are going to panic. They are so starved for calcium that they just start acting like a dry sponge, desperately soaking up every bit of calcium they can find in the blood. This causes his blood calcium to plummet to dangerously low levels, and that can be life-threatening all on its own. So you've got this cure that could be just as deadly as the disease itself. What do? You can't just pick one path. The team had to come up with a coordinated master plan, one that can navigate all these risks and hopefully lead to a successful outcome. And this is the incredible plan they came up with. First things first, they had to put out the immediate fire by aggressively treating that hip infection. Step 2, they used that medication, a drug called cinacalcet, as a temporary bridge to get his hormone levels down and stabilize him.
Step 3, they fine-tuned his dialysis. And only then, in step 4, did they go in for the surgery, removing 3.5 of the 4-row glands. And this is the genius part, step 5. They don't wait for the problem to happen. They plan for it. They had a full-scale protocol of IV calcium and special dialysis ready to go the very second the surgery ended, all to manage the hungry bone syndrome they knew was coming. And you know, what this all comes down to is teamwork. A case this ridiculously complex, there's no way one person could solve it. This wasn't just an endocrine problem. It was a kidney problem, a bone problem, an infection problem. Success was only possible because you had endocrinologists, nephrologists, orthopedic surgeons, and anesthesiologists all working together, coordinating every single step of this delicate dance.
And that really leaves us with this incredible thought, doesn't it? This case is such a powerful example of a core challenge in modern medicine. It wasn't just about figuring out what was wrong. It was about designing this complex, high-risk, perfectly timed plan to pull a system back from the brink. It just goes to show, when the body's own internal controls fail, medicine has to get just as creative, just as intricate to step in and restore that delicate balance.